So after your endoscopic procedure, you'll be transferred when you wake to one of these very comfortable Jason recliner chairs, and here we'll be provided with some drinks and some well-earned food. The gastroenterologist will come and talk with you about your procedure, explaining in detail what they've done, what they've found, and provide you with a written report. Often during procedures we take samples, small tissue biopsies, and these may take 3 or 4 working days before they're returned. So we'll either follow up at our rooms or back with your general practitioner, who will also receive all this information. Now, endoscopy is not without risk. There are anaesthetic risks, and there are risks related to endoscopy itself. When we think about the risks related to endoscopy, they start in regard to a gastroscopy in the mouth. You may have a sore mouth, you may have damage to your teeth or dental crowns, and we take every precaution to avoid that, but that can happen. If we undertake a stretching procedure of the esophagus, referred to as a dilation, because the esophagus is stiff or narrowed, there's a very small chance of a small tear developing in the esophagus. So that's called a perforation. If a perforation occurs, this may require transfer to a hospital. When we take samples, there's a very small chance of bleeding. We try and minimise those risks by avoiding blood thinners before the procedure, but there's still a 1 in 10,000 risk of bleeding, and that risk goes up to about 1 in 1,000 or more if we are required to take off a large polyp, and that's particularly the case when we undertake colonoscopic evaluation. There's also a small chance of perforating the stomach, the duodenum, or the large bowel during procedures. The risk is very small, about 1 in 5,000, but the risk is real. And in that instance, patients may present with some abdominal pain after the procedure and may again need to be transferred to a hospital, perhaps to have a surgical intervention to repair the small perforation that's occurred. Often patients feel tired after procedures. Sometimes they'll feel a bit bloated, they'll feel a little bit uncomfortable, and that will pass within about 4 to 6 hours. If there are any problems at all that you experience after a procedure, please bring that to the attention of the centre or your general practitioner.